Tonight, I am pleased to introduce our panelists this evening. Dr. Heidi Prather is a board-certified physician in physical medicine and rehabilitation and sports medicine and a diplomat of the American Board of Lifestyle Medicine. She serves as the founder and medical director of the HSS Lifestyle Medicine Program. She has practiced non-operative musculoskeletal medicine for nearly 3 decades and enjoys clinical work, teaching, and research. Frustrated with the healthcare system's limitations in healthcare provider collaboration and patient access to services needed to improve their musculoskeletal health, she developed the HSS Lifestyle Medicine Program to enable a focus on whole person health. Practicing lifestyle medicine has given her hope and energy to be involved in healthcare, not sick care. Cara Suter is also joining us, who is a physical therapist and the care coordinator and program facilitator of the Lifestyle Medicine Program. As a PT, she evaluates, treats, and patients as a whole to get to the root cause of an issue. This mirrors the goal of lifestyle medicine, which is seeing person as a whole in order to optimize their health. Griffin is a nurse practitioner who has worked at HSS for over 13 years. Prior to HSS, she was a travel nurse and had the opportunity to work in several different areas of the country, primarily in cardiology and oncology. The unifying factor of her varied work experience has been witnessing the impact of lifestyle choices on health outcomes. Karen is excited to be a part of the lifestyle medicine team and empower patients to make holistic lifestyle changes that can optimize their health. She is particularly interested in shifting the focus to give individuals the option to be active participants in their well care. And finally, Kathryn Cohen is a registered dietitian nutritionist and is the clinical nutritionist for the HSS Lifestyle Medicine Program. Prior to HSS, she was the dietitian for the Lawrence J. Ellison Institute for Transformative Medicine of USC, where she counseled patients on using diet and lifestyle strategies for chronic disease management and prevention. In her role at HSS, she strives to provide patients with the knowledge, tools, and inspiration they need to be proactive about their own health journey. Thank you all so much for joining us this evening. I'm very pleased to get into the meat of this discussion and presentation. And I'll turn it over to Dr. Prather to start us off with the stages of behavior change.
Great. So thank you, Claudia, for having us and for assembling us together about this specific topic. So behavior change is something, we kind of think of on the side, but there's actually a process that people need to go to. When I was fortunate enough to start the first program like this, I had been in practice over 20-something years, and I had patients in my practice for over 20-something years that stayed with me. And I always thought, gosh, if I could just get these people what they needed, meaning access to a Kathryn Cohen, a registered dietitian, access to a health coach that can help them, I could get them to the place that would be better. I know exactly who these people are. Well, was I wrong? Really, some of my hardest challenge patients that I thought could never make change, because they were ready to make change, were able to do it. And some of my patients that had chronic diseases, but really weren't in that state of change, they didn't benefit from the services we offered. So understanding what behavior change is super important. And you'll find yourself in where you are. The fact that you're on this webinar tonight tells me you're probably around stage 2 or 3 already, if not further along. So the first thing is to introduce what is behavior change. So stage 1 is pre-contemplation. Pre-contemplation is, I have never really thought about change, and I never thought why I needed to change, and maybe I don't even understand that things are associated together. And so when we meet people like that, we start to associate things like, hey, do you know that your knee arthritis and that swelling in your knee that's so painful doing stairs and getting on the subway, maybe taking care of kids somehow, is related to your type 2 diabetes, because they're both rooted in inflammation. And if we start getting better control of the diabetes, might see benefits and better control of pain. So marrying two things together is usually the first thing as a provider I should be doing for somebody who's really not contemplated change. Stage 2 is when you're starting to think about it. Oh, my knee is really bothering me. My diabetes, yeah, they always tell me my numbers are somewhere a little bit up and down, but I've never really physically felt different. Now I'm starting to physically feel different. What are some of the things I can start to do? And then as your provider, I need to start filling in the gaps, maybe of education of, hey, look into this or look into this, not forcing anybody into things, but just think about if that's something that would fit for you. Stage 3 is, okay, I'm preparing for change. I've looked into exercise for my knee. I've really started to think about how I can change my diet that might help my type 2 diabetes control. But maybe you've been reading about the books, but you haven't actually made the new food, so to speak, or tried the new exercise, but you got the tennis shoes to try it. Stage 4 is when you're like, okay, I'm ready. I'm there. I'm ready to go. I'm in this phase of ready to make changes in my life. And there's ways we can ask people about that, about their confidence in doing it, because they've had previous tries and maybe didn't work. How willing are you to try doing that? And those are some of the questions we may ask. And we're trying to figure out where people are in that behavior stage of change so that we can meet them where they are. And I just don't say, well, you need to do this, this, and this. That doesn't work. We're humans. That's not how our brain works. So understanding this is really important. Stage 5 is maintenance. And it means once you've made a big behavior change is how do you maintain it? We will, behavior change is all about trying to make the best choice in the moment. And sometimes the best choice it's the best choice in that moment. It may not be the absolute end all be best choice of all things possible, but in the moment you're trying to make it. So we have to expect relapses, and relapses is, had some holidays, maybe didn't exercise as much, definitely didn't sleep as well. I got to get back into that change. And so that's part of behavior change, is giving yourself the acknowledgement and space to know this isn't we're not trying to be perfect. We're just trying to go towards better choices overall. And so again, as a healthcare provider, I need to be aware of that and get people to a maintenance phase, but also supply them with resources, whether that's in their community or outside the community, even, things we're trying to develop here at HSS, where you can go back to and kind of get a refresher and get excited about where you were with your behavior change as you were before. So you got the next one, Claudia? So there's this concept behind this called the diffusion of ideas model. And what it is people are more likely to adopt a new behavior when someone they respect or admire endorses it, right? J-Lo gets on a commercial. She's showing me what she's got, what moisturizer she uses. I'm ready to go because she looks great. Maybe I can look like J-Lo. We all know that's, and so it's important to recognize that and how opinion leaders can really influence our an initial group, how social norms can be established, and the rest of the community can kind of follow along, kind of social confirmation. And obviously this has exploded more with the more access we have to data and social media over time. So being aware of that's important. So next slide. So behavior change is really a process. Again, we go from that stage of I'm unaware, I need to associate these things, to being aware. You might become more concerned about it, and that being concerned then leads to gathering of knowledge. That's when you get into that motivated stage of change. You may do some trials behavior change. Sometimes that's successful and sometimes it's not. Again, giving yourself space, that just doing something perfectly the first time is not the goal. It's just to try something that may help you with your health, and then sustaining it. And again, being prepared for a relapse and getting support systems around you to support your behavior change can be really important. So there's channels for doing this. Again, the mass media, community networks, and traditional media can be helpful. Interpersonal group communication can be very, very satisfying and helpful. We also need enabling factors. So effective communication, enabling the environment around you, and using friendly services and accessible commodities. So what we mean by that is we need to lean into making choices around us of either groups we hang out with, people that we rely on, how we interact with media that we know are positive for our well-being. If your friend group always goes out for pizza and then kind of prods you that pizza is tonight's tonight, you need to eat like what everybody else is, and not supporting your change, you may need to think about how you approach, maintaining those relationships and making sure they recognize that you need their support and how you're trying to make things healthier for yourself. So next slide. So there's myths and facts about behavior change. So myths are that crisis is always a powerful impetus for change, and it can make you think about it, but you can't necessarily immediately go from pre-contemplation to an active stage overnight. And there needs to be preparation in that. It may be an impetus to get you started to think about it, but not necessarily active change. Change is always motivated by fear. Yes, fear can be started, but really to go through the change behavior model itself, you'll have to do preparation and reconciliation of that. Another myth is we can't change because our brains become hardwired early in life. Well, it is harder to change when you're older, for sure. But we're not hardwired. You can make change. It does take some insight, it takes some support, it takes some knowledge of knowing it'll take time, but you are capable of doing that. Another myth is change behavior methods don't yield adequate results. That's not true. Lifestyle medicine is based all around this, and it's a form of specialty of medicine. Karen, Griffin, and I actually are diplomats of the board. There's a board test that we took after getting certain experiences and extra training. And it's really built all around this model that choosing things that are healthier for our lifestyle enables us to be healthy. And so it's very, very possible for that to happen. Change behavior is not sustained. Change behavior is when you get the knowledge behind why you're making the change, reflection into how that helps you, reflection into how it makes you feel, and change behavior becomes something you actively opt into on a regular basis. Now, you can opt into it's Christmas and I'm gonna have a glass of wine and I'm gonna have the fruitcake and I'm gonna have the whatever. But tomorrow I'm going to choose to go back to these other behavior changes that I know have made me healthy. So again, it's always opting in for a positive activity. Facts we know about behavior change: people go into denial of the bad things that might happen to them. So to achieve sustainable results, it really does take time. And that's oftentimes the hard part. Once we want change, we want it now, like everything else. And then regular reinforcements are really needed, and you need to recognize you need that. So support systems that help you with that are important to surround yourself with. The majority of patients don't sustain changes in unhealthy lifestyles that worsens their disease, and change for better is always difficult to make. It just is, because of time and commitment. We can continue learning complex new things throughout our lives, though. So behavior change address should be the felt need of the people that are targeted to it. So feeling the need to make that change is an important part of it. And then community involvement is important for success of any change process. So again, supportive people, supportive environments of what you're trying to do to become healthier is essential to your success. So behavior change is a continuous process. It involves community participation. We have to understand and refute the myths and correct misunderstandings of those of us around us. So if you're choosing to, let's say, eat in a direction that helps reduce inflammation in your body, you may have people question you, like, why are you doing that? That's not what I read, and that kind of thing. And that can be a little disarming, but being prepared for why, and that knowledge of why is usually what sustains the behavior change in the first place for yourself. We know social norms and public policies can influence our behavior change. So it's normal to go out for pizza. What's an alternative I can eat, still be with my friends and not eat the pizza, is an example of that. And then adapting change simultaneously provides an advantage for long-term success. So not to overwhelm yourself with changing everything, but setting goals that are attainable, and they might be in different facets. Maybe it's I'm trying to improve my sleep health. Maybe it's I'm trying to increase my physical activity. Guess what? Those two things are married. When you are more physically active during the day, you sleep better at night. So making smart goals, and we'll talk a little bit about those, can really be helpful. And then again, there's a stepwise approach. Again, it's a journey of 1,000 miles, begins with a single step. So again, taking one step at a time, you really have to break apart what your goals are so that you really can get to the big one there at the end. When people come into the program, we ask them, what are your goals? And we write those down. And We talk about nutrition or sleep or getting their pain down or being more physically active, managing stress better. Maybe it's reducing tobacco use, alcohol use. And at the end of that, we'll say, okay, let's say that you're feeling better, you've gotten yourself healthier, you've gone under change behavior and you're feeling good. What will you do with your time now that you're spending doing those things or being unhealthy that you can't do right now? What will that be? And it's interesting. Some people really have to think about it. A lot of people are going to Italy with their grandchildren, that's their long-term goal. I've met 2 people who want to ride a roller coaster, and that one came right out. They were really quick on that. So really thinking about what I can do, spend time on, and that's joyful to me that I can't now because I'm trying to manage some of my health issues, can really be motivating. And that's really your long-term goal. So next slide. So again, SMART goals, so I mentioned, which really what that is breaking up a big goal into small parts. And they have to have these SMART portions of it. So specific, so the goal needs to be very specific. It needs to be measurable. It needs to actually be attainable. It needs to be relevant to what you're trying to do long-term. And it needs to be time-based. I mean, we put a time on slot on this, so we have a specific goal, and then we can go on to the next SMART goal once we've accomplished this, or at least have worked on it. So next slide. Here's an example of what the SMART goal breakdown, this is kind of in small lettering, but specific could be who's involved, what do I want to achieve, when do I need to achieve this, and why is this goal important? The measurable piece could be how will I measure my progress? How will I know it's my goal is achieved? Measurable, I think Kate will talk to us a little bit about using wearables, because that's a great way to measure your physical activity and kind of keep you honest. But having a mechanism to measure things is important. Making sure it's really achievable. You don't want to put something out there that says, I'm gonna go from not exercising at all to running a marathon at the end of the month. Well, somewhere your body's probably going to break down with that much change. So making sure it's something achievable. So will it be clear when the goal is complete? Is it reasonable to complete the goal in the time allotted? And then relevant. Is this goal related to my overall success or the success of my business or organization, right? So the people around me. And then time bound. How long should it take to accomplish this goal? When will I check in on whether or not the goal has been completed? And am I on the start? Am I ready to start to work on the goal? So those are kind of the different components, and then you can actually write out the goal. So I think I have examples of that next, Claudia. So here's some SMART goal examples. Over the next 2 weeks, I will choose 2 new healthy recipes to make for a meal, buy the ingredients, and make those meals. So that's 1 meal a week. Find something you want to make, buy the things, and make it. Very specific. Another one would be over the next week, I will take a walk for 20 minutes sometime during 3 days of the week. Again, measurable, achievable, and relevant to what you're trying to do in healthy behavior change. I think that's what I have there. So thank you for that.
Hi. So I think that I'm kind of picking up on the SMART goal idea. And what I like, by the way, about those last 2 goals that Dr. Prather gave as examples is they really demonstrate the difference between the stages of change, really between the prep stage and the action stage. Because if you're preparing, I find that people's goals are much more vague. I want to get healthier, I want to make good choices. But when you're really ready to take action, your goals get very specific because you're ready to, that's where the rubber meets the road, so to speak. So for some of these, I wanted to kind of give you some ideas about some of the different ways that one could, really track themselves if you want to be accountable and if you want to use tools to help create these very specific goals. But so there are a number of good tools out there. Most of these are apps. A few of them are websites. You can find an app for everything, as we all know. You can be tracking, some of these track activity, some of them track diet, some of them can connect with wearables. I've got a few wearables here. I think the most important thing, though, I want to get across with the technology is that you really have to find what works for you and not let the technology get in the way of what you're trying to accomplish. I found some of these apps when I've worked with patients that they're really complicated And it can take a long time to try to get up to speed and learning how to track your food and how to track your activity. When if you're really just trying to keep yourself accountable about what you're eating, you can write it down on a piece of paper. Or you could use, I even put this notes app. I have a lot of people who just use the notes app because for them, it's just about writing it down and not not kind of getting stalled in the process by the technology. So it's good and bad. I love technology, but I also want people not to get kind of too caught up by it and lose sight of what you're really trying to accomplish. I can go to the next slide. Barriers. I know this is something Dr. Prather spoke about, and we'll probably talk about it more. And this really applies with, with so many different areas that we're trying to work on, whether it's, managing your nutrition, managing your stress, your activity level, improving your sleep. Everybody has barriers, right? I find that they come down to a lot of big categories. Time. How much time do you have? How much time are you giving to other people? Are you managing a family? Are you working full time? Does it take you a long time to commute to work? Knowledge. Do you know how to create a good meal? Do you know what food you should be eating? Do you know how to create an exercise program? Confidence. Do you feel like this is a little redundant, but do you feel confident in your ability to kind of get the job done, to go and do a good workout and to accomplish a goal, whether it's to get healthier, to get yourself to a healthy weight, to just feel like you're a good example for your family. Lack of preparation. Again, a lot of these things spin on each other. If you don't have the time, you don't feel like you have time to cook, time to do research on, where you can work out, what you should be making. All these things can get in the way. But I think what a lot of them come down to is that a lot of us have trouble making ourselves important enough to focus on. If you have a family, if you have a job, if you have a spouse, a lot of times other people's needs come first, but it's really important to recognize that the way that you can make change is that you have to be a little selfish and put yourself first as far as making your goals. That's my last one. And part of that is about planning ahead. Now, this obviously is very specific to me because it's about planning ahead as far as like planning your food. So it's a very specific goal. But I find that, when you're in this action stage, it's very easy to, to fail if you're not able to put the time in ahead of time to really look ahead and say, this is what my week is going to be like when it comes to where I want to put my time to get healthier. I want to exercise. I want to plan my meals. I want to know that I'm bringing something healthy for lunch. I want to have something healthy for breakfast. So putting the time in, whether it's an app, a piece of paper, printing out a meal plan that you can just fill in, this is definitely in the action stage. You're making a plan, you write it down, you're accountable to yourself, and you adjust as you go along, because we all know there's going to be obstacles and you should expect them and then just roll with them. Easier said than done sometimes, but I think Dr. Prather also talked about it, is that you have to recognize that you're not going to be perfect all the time, and you make mistakes and you move on. That is, I think that's my slide.
Okay. And now Cara, who will be talking about her role as the care coordinator and some problem solving tricks.
Hi, everyone. I'm going to be talking about the role of the care coordinator in our lifestyle medicine program. And the role of the care coordinator really helps with behavior change. I call our patients every 3 weeks to check in and follow up to see how they're doing and to see how things are going. I help to coordinate and monitor the patient's plan of care throughout their entire journey in the program. I collaborate and consult with the team to facilitate their journey, and so the patient could adhere to their desired outcomes and to their long-term goals. I engage with the patients to encourage that they adhere to their care plan, and I empower them to achieve their goals. Just by calling them every 3 weeks, it really keeps them accountable. I assist with problem solving for patients to stay on track. And when life throws a curveball, I'm always there to chat, to listen, and to talk about the best next course of action, depending on what the situation is. Next slide. So this is just an example of some problem solving ideas. So when I speak to some patients that their ultimate goal is to lose weight, patients talk to me and say, I need to lose 50 pounds. But like we spoke about before, and what Dr. Prather and Kate highlighted was 50 pounds is a huge goal. So we need to break that large goal down into smaller pieces, into attainable goals. So for example, we could break down that overall goal of losing 50 pounds to maybe let's try to lose 1 to 2 pounds per week over a certain time period. So another example is that a patient was instructed to eat plant-based meals, and she was really overwhelmed about the fact that she really needed to incorporate more fruits and vegetables and to eat less meat. So we discussed incorporating more fruits and vegetables, finding more recipes, and to make one recipe for dinner that does not incorporate meat. And the patient was able to adhere to the smaller goals. And over the next 2 months, she was eating one meal per week, only one meal per week with meat, which was really great for her.
Fantastic. Thank you all so much for getting us started on this very important topic. I'd like to open it up to a discussion now, and, thinking about behavior change a bit more generally. Let's talk a little bit about habit formations. I'm staring at my bookcase right now, Atomic Habits, and I think that there might be some information or misinformation about how important habits are or not to behavior change. So can we talk about what the science says behind habits and why people might be misled about why this is important or not?
Yeah, so thanks for that question. So there's, I think, the book 7 Healthy Habits of achieving people or people in leadership. We see lots of taglines about habits, and habits are things that we do on a routine basis, and it may even be remote. Like, it's not necessarily you're making an active choice to do that at some point, and it's something you can pattern yourself to do. Having the psychology literature is really unclear. There's no definitive answer right now that shows that habits themselves actually affect long-term behavior change. So if you want to split hairs, which is what I'm doing here, is active behavior change. You're actively opting into something that you receive benefit from, because you receive the benefit, you actually change your behavior long-term over time, and it just becomes a part of how you live. Versus a habit may be something you don't like or don't see the benefit in, but no, it's just something you're supposed to do. You may not receive that benefit, and again, it may be more of a passive thing. I can admit to, I love to exercise. Here's my habit. Okay. I love to exercise. I am very proud. Last week I had 672 minutes on my Fitbit. Very, very proud of that. Right. I like to do aerobic exercise. I like to do meditation and relaxation. I do flexibility. I do not like to weightlift. So for me, weightlifting is it's a habit. And I do it on certain nights, do it for a certain amount of time. I've got the TV, the music, and something else going to get myself to get it done, and I get it done. And part of that is because I don't think I'm good at it. Part of it is in high school, I'm an athlete from the late 70s, early 80s, when girls weren't really athletes, and they threw us in the gym with the football players who made fun of you because you couldn't lift weights. So, I got my tragedy behind why I don't like to lift weights. I can tell you, though, if I'm on vacation, my lifestyle is I will walk or run, and I will find a way to do it. When I'm on vacation, the first thing that goes is lifting weights. I don't make any effort usually to figure out how to do that. And that's kind of the example of the difference there. One you will seek out because that behavior change has made you feel good versus the habit, I got to do this, I got to do this, I got to do this. And it's the first thing that kind of can go by the wayside. So habits can be really good to help you jumpstart, but you want to know the why behind that's so good. And then you need to reflect on why you find it beneficial to you, whether it's the way you feel physically, whether it's getting you towards achieving goals you've been long-term in. So, I just kind of caution you over just habit changes aren't real. The science behind it too is that for a habit to really take effect, you got to do it for 90 days. And so we can kind of lose interest or lose that motivation if we don't really see the benefit of it for ourselves long term. So I'm splitting hairs with you, Claudia, but that's kind of the difference.
I appreciate the idea though, and I think it's so important that generating the why. And Karen, I'd love to hear how you might help patients develop that why or come to realize that why, or perhaps how we work with patients or community members who may be resistant or ambivalent about making behavior change.
Yeah, sorry. Yeah, so that's part of our initial intake, and I think Dr. Prather alluded to that. So we're always trying to get patients to look at the bigger reason why, what it is they want to do that's they can't maybe physically do now, or something's holding them back at this point, their health. So like Dr. Prather said, you're riding a roller coaster or going to Italy. These are the bigger motivational pieces that we try and ask people to clarify and to keep in mind as they're making these smaller changes. There is a bigger picture.
What are some of the questions, maybe if someone's not in the lifestyle medicine program, but is a community member watching, what are some questions someone could start to ask themselves, or start some prompts that they might start to think about to get in touch with those ideas of their goals? You know, maybe they're just generally feel unhealthy, but don't necessarily have a goal to reach yet.
Yeah, a good place to always start is the low-hanging fruit. So, what's one simple change that you can make that's easily adaptable, that can become a behavior change, whether that's adding more fruits and vegetables, or getting in some activity minutes. The easiest thing is where you want to start, and hopefully those changes start to compound and have bigger effects.
Yeah, also, just like just piggybacking on Karen, thinking about, I failed at that change before. Try a different one, right? So there's 6 pillars of health that we talk about in lifestyle medicine that's based around. So physical activity and the eating thing is always like, oh gosh, I failed it. Like, the energy level of trying that again is low, but you don't feel rested when you wake up every morning. Go towards sleep. Start with that. The pillars are really bi-directional. So when you improve on one thing, it helps with another thing. If your sleep improves, right? If you're somebody who doesn't feel rested, even if you sleep through the night, or maybe you get up and down for various reasons in the middle of the night, whether it's pain or going to the bathroom or whatever it is we do in the middle of the night, we don't get through the stages of sleep. If we don't get through the stages of sleep, there's this substance that's let down in from our brain that suppresses our appetite the next day. There's a substance that comes down in our brain that keeps us from being fearful or anxious the next day. So if you're constantly not in those stages of sleep, you're constantly in those states of, gosh, where's the next thing I can eat? And boy, I feel agitated or edgy today. So it actually helps those things, right? Your nutrition may improve simply because your sleep's improved. So I would say, if you feel like you failed at something before and you're doing this on your own for the first time, find the low-hanging fruit. Maybe look at a different pillar that you think you could at least try something new with. And when you get success in that, you can go back to the thing that seemed like really hard to achieve in the past.
There is a question from the audience about suggestions that might keep me interested in going to the gym. So maybe it's not a setback or a relapse, but rather just a general interest problem. The participant noted they don't have a weight problem, so it's more for general health. I get bored while I'm there and find it very easy to skip a planned workout.
I have a good answer for this one. If you don't like going to the gym, don't go to the gym. There are so many things you can do to work out. I have this conversation with patients every day that you have to pick something that you like. Dr. Prather has all these different things she likes. And I would like to say, I love lifting weights, but you have to find the thing that you really like that you want to keep doing, or you won't keep doing it. To her point, as soon as you get on vacation, the thing you stop is definitely the thing that, that's not part of your life. So if you hate going to the gym, we used to buy elliptical machines. I've owned 3 of them in my life. They come into our apartment, they sit in the corner, they're drudgery. I hate it. I never want to go on it. You have to find the thing that you like that you can make fun. I love taking walks. Like I find the things that I like and that keeps me doing it. So think about something that you would actually like to do, whether it's taking walks, going on a spinning bike, mountain climbing. There's so many things, especially around where we live. You have so many choices of what you can do. If you find yourself going, oh, how can I keep going to the gym? Then you're on the wrong path. It doesn't have to be, hateful to move your body and to have activity as part of your life.
Kate, I'd love to hear you talk a bit about how you can apply that approach to food as well, because I feel like a lot of people might come to you and think they don't like healthier options or what might be perceived as healthy food. And so how do you work around that?
Well, it is kind of similar. My goal is not to make you eat things that you really don't like. I would like to help you understand that we know certain foods that will help reduce inflammation and help contribute to you being healthier, but it doesn't mean that it all has to, be unpleasant and that you have to be kind of choking it down. For example, I'm a big fan of the air fryer. Like I'm a big fan of kind of finding tools that make it easier, that where you can create food that's really palatable, you can make it really simple. And, I just ask a lot of questions. And I think the key to what all of us do is to make the process very collaborative. As Dr. Prather said, we don't just get in the room and say, you got to do this, and you got to eat this food. It's about, what do you like? What are some of the fruits you like? What are some of the vegetables you like? What's your lifestyle like? Do you cook? Do you order out? Where's your food coming from? Are you cooking with your kids? And really kind of brainstorming and coming up with solutions. There are, just like there's a million things to do to work out, there are too many kinds of food to eat to routinely try to be eating food all the time that you don't like.
Yeah, and as Cara even mentioned in her presentation, it's just incorporating it into one meal, let's say, or one vegetable into one meal, that low-hanging fruit as well that Karen mentioned.
And you just start slow. I usually start with breakfast. We usually talk about how to just kind of make some substitutions just to make things just like a little bit healthier. And you just kind of go from there.
There's a question in the chat about pain that might be preventing from exercise, but you really want to. So the participant said, what if you are in pain and it's preventing you from exercise, but you really want to? And I know that, there's a lot of information around pain, but Dr. Prather, do you mind addressing that?
Yeah, so that's something we always got to work around. And in fact, in the lifestyle medicine program at HSS, everybody is coming in with a musculoskeletal condition that is associated with pain. And as a result, the vast majority, it's like 57% of patients in the program, 0 physical activity minutes. That's bad, right? And so we have to find a way to figure out how to move without exacerbating the musculoskeletal condition. So if you got a bad knee, a bad back, a bad whatever, the painful condition is, you got to work around that. And sometimes you can figure that out on your own by changing the activity. A pool is a great way for people who have pain with weight-bearing activities, so putting weight through it. I know I'm in Manhattan, that's a little hard sometimes to find a pool, but that can be a way of doing it. The other thing is, we think physical activity is physical activity. It doesn't have to be sweating it out in a gym type of activity. If you can do 3 walks a day for 10 minutes at a time, that's phenomenal. That's 30 minutes. You get to accumulate the minutes together. So even if you can do small chunks of things over time is super important. The other thing is physical activity can involve not just the aerobic piece, but flexibility. It also involves obviously the resistance piece, what we're talking about with like weightlifting or resistance bands. But there's always a way to modify it. And if you're struggling to figure out what that is, that's what a physical therapist can help with. We have both physical therapists, and we actually have the benefit of getting to work with an exercise kinesiologist, who's really been helpful in getting people finding ways to move without exacerbating their problem. And it's quite phenomenal to me that these are people, a good portion of people are waiting to have surgery, trying to get healthy, and they're able to actually move better before the surgery. Surgery is going to come out better. So it's possible. You may need some support and help in figuring that out yourself if you've tried. but there's resources around you that can help you with that.
Thank you. And Cara, this question is interesting. As the care coordinator, I'm curious to know what you think. Someone asked, what is the role of dealing with emotional distress from the past as an obstacle to achieving goals? So have you seen this with patients? And for example, they've mentioned an energy deficit. And how do you identify this, and what do you do about it?
Yeah, so whenever I speak with patients, a lot of emotional aspects of their life comes up, right? I'm talking to someone every 3 weeks, and their journey could be, 3 to 6 months in the program. So I kind of learn a lot about what's going on in their lives. And if someone is showing me emotional distress, I'm not a health coach myself, but we usually refer them to a health coach that's part of our program that could, develop SMART goals, help them, through achieve their goals, or to just vent to, honestly. And then also talking about if they need to speak with a psychologist or a psychiatrist at this point. But typically, if I feel that someone is emotionally distressed, I also bring that up with the other team members to kind of discuss what's going on. But my first route is really referring them to a health coach.
Thank you. And another question, and this will be our last question for the evening, actually, and I think this is a good one. Dr. Prather, you talked about the ways that our environment can shift and change and influence our behavior. And someone asked, do you tell people to skip food commercials, etc.? How should we manage all the media messages that we're receiving?
Yeah.
And I'll just open it up to the floor for this one.
How many people had the conversation recently that should I skip the news? Like, because there's so much kind of crazy going on in our world, and we get so much information overload now, it stimulates us. Yeah, I think being aware of what triggers you is super important. I subscribed recently, desubscribed to something that I've been subscribing to for a while, and it's just it's basically a feed on nutrition. And they've always got like different new ideas, and I like reading it, but the headline is always something that's trying to provoke fear in me. Like, did you know such and such and such and such is awful for you? And I'm like, I like what they tell me in the end of this, but that like startling start, I'm done with it. So I've gotten rid of it. I mean, actually sitting back and realizing what things might really kind of, when you accumulate over time, what they bother you, even a little thing like that can really be helpful. The other thing is, sometimes when we express happiness, joy, commitment, positive action on others, you'll start to realize you receive it back. And it's been really that more literature has been done, especially since the pandemic, recognizing that social connection we need in our community, even if it's with people we don't know, is really important. And so sometimes you have to initiate it to get it back, but then you start to realize that that's super important. And I'll talk to patients about that a lot. An example I typically give is I'm from Missouri, and we're stoic people there in the Midwest, and I lived most of my life there. And I thought I would just be eaten alive by New York people. Like, I don't know how to live in a big city like this. But what I really noticed, things that really brought me joy, was when I get off my elevator, and there's a million floors in my building. When I get off my elevator here, there's 2 or 3 people in the elevator say, "Have a good night." And it's just, maybe it's a habit in New York, but I find that just super and nice and lovely. And now I initiate it because I know someone's going to initiate back. So that's just a strange little example, but I really recognize how someone notices me. Someone is expressing gratitude towards another human, and how that can really help each other. So again, suppressing things that may be giving you a negative feedback that you realize may stimulate you, but also giving back to others, you'll start to see how it makes you feel, not just in the giving piece of it, but that you actually receive things back from that. And that I call environment, maybe the environment in which you live or the environment in which you work. Little things like that can really be important to our overall health.
That's so fantastic. And it's not a habit if you understand the why. So if you're getting off that elevator and you're wishing everyone a good night for yourself and for everyone else, what a beautiful thing. Before I share some information about upcoming programs, I just wanted to open up to the floor. Any parting words for anyone who is looking to improve their health?
You want to go for it, Kate?
Don't judge yourself. Acknowledge that this is hard. It's hard for all of us. It's not like it's easy every day. There will be obstacles. This is what I usually say to people around the holidays, that even if you have a bad day, you get up the next morning and you just start again. And that's what keeps you going, because life is, it's a marathon and not a sprint. And so you just kind of keep going and keep finding new ways to grow and evolve.
And I just want to say that you can do it. You can. You just have to believe in yourself and have the confidence, and you can make small changes that grow to larger ones, because I've seen it. So you could do it.